Hi guys, welcome. I hope all of you are looking into the videos of the PSM resident class. If you're not, I guess you're missing out on this. And this particular video is on a very interesting topic which you must be knowing. And if you don't, just watch this video and enjoy the video. If you have any queries, any doubts, or any particular topic you want me to teach, you can just drop me a message on my WhatsApp number. The details are given below. Yes, guys? Okay, guys, let us look into something which we call as the research protocol. The moment you enter into first year PG, you might be of any specialty. The very first thing your professors and your department will say that the deadline for your research protocol submission is date X. And we think, what nonsense is this? ये कौन सा MCQ में पढ़ा था? Which subject is this? Which textbook did we read for this? Technically, in MBBS, we have never ever heard this word. But when you talk about the PG setup, this is a mandate for you actually to give the PG exams. So let us see what do I mean by a research protocol. Interestingly, guys, this also features as a short note in one of the papers as well for non-PSM postgraduates. For PSM postgraduates, this can also act as a long question. Yes, guys. So let us see what do I mean by a research protocol. So if I want to define it, a research protocol is potentially a map of your research. Of what you will be doing. How and why. Protocols typically have the following headings. The first is the background. Where we basically spell out the why. Why this is an interesting topic. What is its relevance? The relevance can be at a patient level, can be at a population level, or can be at the policy level. So 3 P's. For clinical residents, they mainly follow only till the patient level. For public health specialist, PPP, everything should be defined. Yes, guys? Now, next, what is the gap? So whatever info is available as of now, we will see what gap is there in it. This is the background or the introduction, whatever be the nomenclature to be used. The next comes is the aims and objectives. Here we look into the what of study, that is a broad aim on what are we going to do. Or we break it into some measurable objectives. Like for example, my aim is to identify the preferred source of healthcare in an area. And the objectives can be to interview 30 females in 3 villages and to know where they went for their last illness, or they went for their child's last illness, something like this. Now guys, when we look into objectives, there are again some guidelines, some criteria where we look into how to frame objectives. We'll see that in the later due course. Okay, I'm just giving a primer into a research protocol as of now. So once aims and objectives are done, now we'll look into the methods. So this methods is actually going to give you details of the data collection, like the setting in which the study will be done, who will be the participants, how will we recruit them, in this we will apply some basic inclusion and exclusion criteria. Yes guys, we will look into the sample size, the sampling, the study designs. Rather, I should put the study design first, because based on that I will calculate my sample size. Again, this sample size is determined from the primary objective. See, in a given study, you can have multiple objectives, but it's the primary objective which actually tells you the sample size. Next, we look into the process of sampling. We decide what form of tool to be used. We make a data collection and a data analysis plan. Yes guys, no problem in this. Now, once this is done, these are all determined by the thing what you want to do and also the resources you basically have. In the method section only, generally we have a time scale. Here we use a very peculiar chart called as the Gantt chart. Interestingly guys, if you ask me as a researcher, I would say this is the most important thing which you should be careful of doing, because this is only going to help you to pick up, okay, this is the thing what we should achieve as on today. This is a thing what we will do later. Yes guys. So this Gantt chart basically tells you how long is it going to take. It identifies the key milestones. Now, after this, we have to put up a segment on the dissemination and the output which we expect. Yes, so in this, the first is, who is the target audience? Next, the plan for dissemination. Whether you want to go for an internal, that is in your agency, or external dissemination in form of reports, conferences, or some workshops. Yes, or whether you want to go for a publication. This, my dear students, is what comprises a research protocol, but it also ends with some references. The references which you have actually used to identify the gap, why the topic became important, what is the relevance, when you took a landmark article to determine your sample size. So this on a whole completes a research protocol. Generally guys, we get the research protocol from our senior, we look into the format and just put some shits here and there. Trust me, if you just look into this quick video, you would realize that guys, it is actually very easy if you know why are we doing a particular thing. That's all for this particular topic. Join in for such exciting topics to the resident course by DAMS PSM. That's all from my guys. See you guys. Thank you guys. Thank you for watching this exciting video. Do drop in your messages, your comments, or any improvement you would like to see, or any other topic which you want me to take up in the PSM resident course. This course, which has been running for almost last 1 year with almost 500 active subscriber across the country, PSM residents of the first year, second year, third year, plus even I do have senior residents and even some consultants, faculty members doing this course. So do not miss out on this. Please, please, please subscribe. And if you have any queries, do reach out to me. Your host, your dost, PSM said.